Hi everyone, my name is Mika. I'm here to talk about the study of who's crazy here anyway. I'll start by telling you the definition of abnormality, which plays a key role in determining whether or not someone is diagnosed as mentally ill. And the diagnosis largely determines the treatment received by a patient in a mental institution. Our researchers were trying to learn how to discriminate the difference between normal and abnormal behavior in psychology. We wanted to classify what behavior is used to diagnose someone as mentally ill. And now I will hand things over to our researchers.
Thank you, Dr. Michaela. I'm Dr. Samantha here to talk about the hypothesis of who's crazy here anyways. During this experiment, we diagnosed whether the characteristics of patients' psychological diagnosis is because of who they are, or is it based on what context the psychologists find the patients in. We wanted to know that if mental health professionals have received adequate training for diagnosing people with mental illnesses, then those professionals should be able to distinguish between someone with a mental illness or someone that does not have one. We proposed an idea to test mental health professionals' ability to diagnose patients. We had normal people seek admittance to psychiatric facilities to see if mental health professionals would see that these patients are healthy. So, we asked the fake mentally ill patients to behave normally in a hospital, just as they would in their daily lives outside the facility, because we wanted to see if the mental health professionals and staff could diagnose these patients as normal, or if they would fail and say they have a mental illness. If this was proven true, that they failed, this would provide evidence that diagnosis of the mentally ill are tied more to the situation than to the patient. And now to Dr. Yasmin.
Hi, my name is Yasmin, and I'm going to be talking about the methods of this study. Rosenhan recruited 8 subjects, including himself, to serve as pseudo-patients. The 8 participants, 3 women and 5 men, consisted of 1 graduate student, 3 psychologists, 1 pediatrician, 1 psychiatrist, 1 painter, and 1 homemaker. The subjects' mission was to present themselves for admission to 12 psychological hospitals in 5 states on both the east and west coast of the United States. All pseudo-patients followed the same instructions. They called the hospital and made an appointment. Upon their arrival, they complained about hearing voices that said empty, hollow, and thud. Other than this single symptom, all the subjects acted completely normally and gave truthful information to the interviewer, except their name and their occupation. All the subjects were admitted to various hospitals, and all but 1 was admitted with the diagnosis of schizophrenia. Once inside the hospital, the pseudo-patients displayed no symptoms whatsoever and behaved normally. The participants had no idea when they would be allowed to leave the hospital. It was up to them to gain their release by convincing the hospital staff that they were healthy enough to be discharged. All the subjects took notes of their experience. At first, they tried to conceal this activity, but soon it was clear to them that the secrecy was unnecessary because note-taking was just seen as another symptom of their illness. They all desired to be released as soon as possible, so they behaved as model patients, cooperating with staff and accepting all medications. The medications were not swallowed and they were flushed down the toilet. Now I will pass it on to Melissa with the results.
Thank you, Dr. Jasmine. I will be discussing the results of this study. The key finding in this study was that not one of the pseudo-patients was detected by anyone on the hospital staff. When the pseudo-patients were released, their mental health status was recorded in their file as schizophrenia in remission. Now, although the hospital staff of doctors, nurses, and attendants basically failed to realize that there were pseudo-patients in hospitalization, 35 out of 118 of the real patients actually voiced suspicions that the participants that were there were not actually mentally ill. They would make comments such as, "You're not crazy, you're a journalist or a reporter, or you're just here to check up on the hospital." And although contacts among the patients, whether they were the pseudo-patients or the real patients, and the staff were often minimal and bizarre, one of the tests of the pseudo-patients was basically just to start approaching the different members of the staff and asking them normal questions such as, "When will I have ground privileges?" or "When am I likely to be discharged?" Now, usually when the pseudo-patient would ask one of these questions, they would say, they would just say it in a very normal way, like, "Excuse me, doctor, could you tell me when I'm eligible for grant privileges?" And usually the doctor or whoever it was would just respond with a "Good morning, how are you today?" and basically just ignore the question and move on, whether they got a response or not to the "How are you today?" question. Now, the 8 pseudo-patients in the study were given a total of 2,100 pills that were obviously not taken by them because they're not real patients, but they did note that the real patients that were hospitalized actually secretly disposed of their pills down the toilet, and very often. Another thing that was observed by the pseudo-patients was that one of the nurses in there actually unbuttoned her shirt in a room full of male patients. And it actually wasn't her intention to be provocative, but she didn't consider the patients to be real people. So these are the results of the study, and now I will be handing it off to Dr. Jimmy to discuss the significance of the findings.
Thank you, Melissa. Hello, I'm Dr. Santos, and I'm going to talk about significant findings of the study. The results pointed out 2 crucial factors. First, it appeared that the sane could not be distinguished from the insane in mental health hospital settings. As Rosenhall himself stated in his article, the hospital itself imposes a special environment in which the meaning of behavior can be easily misunderstood. The consequences to patients hospitalized in such an environment seem undoubtedly counter-therapeutic. Second, Rosenhall demonstrated the danger of diagnostic labels. Once a person is labeled as having a certain psychological condition, such as schizophrenia or depression, that label eclipses any and all of his or her other characteristics. All behavior and personality characteristics are then seen as stemming from the disorder. The worst part of this sort of treatment is that it can become self-confirming. That is, if a person is treated in a certain way consistently over time, he or she may begin to behave that way. Out of Rosenhall's work grew greater care in diagnostic procedures and increased awareness of the dangers of applying labels to patients. The problems this study addressed began to decline with the decrease in patients confined to mental hospitals. This decrease in hospital populations was brought about by the discovery in the 1950s and increased use of antipsychotic medications, which can reduce symptoms in most patients enough for them to live outside a hospital and in many cases lead relatively normal lives. Concurrent to this was the growth of community mental health facilities, crisis intervention centers, and behavior therapies that focus on specific problems and behaviors and tend to avoid labels altogether. This does not imply by any means that the mental health profession has eliminated labels. However, largely because of Rosenhall's research and other research in the same vein, psychiatric labels are now used more carefully and treated with the respect their power demands. Now we will hear from Dr. Ford.
Thank you, Dr. Santos. Now, as we all know, being psychologists, hardly an academic study is published that has not faced questions and criticisms. And Rosenhan's study, of course, is no different. One research and teaching hospital had heard about the results of the study and were highly skeptical, to say the least, that the aforementioned diagnostic mistakes mentioned by my colleagues previously could be made in their hospital. Seemingly taking exception, Rosenhan countered with another experiment, telling hospital members that over the following 3 months, at least one pseudo-patient would attempt to be admitted into their psychiatric unit. Staff members were then asked to rate each patient on a 10-point scale on the likelihood that he or she was a pseudo-patient. At the end of the 3 months, a total of 193 patients were admitted. Of those, 41 were considered with high confidence to be pseudo-patients by at least one staff member. At least one psychiatrist suspected 23, and one psychiatrist and one staff member identified 19. But here's the thing though. Rosenhan hadn't sent any pseudo-patients to the hospital. It's crazy, right? He said, quote, "It indicates that the tendency to designate sane people as insane can be reversed when the stakes, in this case prestige and diagnostic ability, are high. But this one thing is certain. Any diagnostic process that lends itself so readily to massive errors of this sort cannot be reliable," end quote. He then replicated this study several times in 12 different hospitals between 1973 and 1975, finding similar results each time. Other researchers weren't so sure about the conclusions that Rosenhan drew here, though. One argued that it should not be difficult for pseudo-patients to lie their way into a mental hospital because many admissions are based on verbal reports. The reasoning here is that a person could just as well walk into a medical emergency room complaining of severe gastrointestinal pain, causing them to be admitted and diagnosed with various gastrointestinal ailments. Even though the doctor may have been tricked, the diagnostic procedures were not rendered invalid. Furthermore, it was pointed out that the pseudo-patients behave normally once admitted to the hospital. Symptom variation occurs with psychiatric disorders commonly, and that does not mean that staff were incompetent in failing to detect the deception. Thank you for listening. Here to discuss other applications of the findings is Dr. Roman.
Thank you, Doctor. As an indication of this continued controversy, we can consider two of many studies that have used Rosenhan's research in challenging the validity of diagnoses made by mental health professionals. One of these was conducted by Thomas Saz, a psychiatrist who has been a well-known critic of the overall concept of mental illness since the 1970s. His contention is that the mental illnesses aren't diseases and cannot be properly understood as such, but rather must be seen as problems in living that have social and environmental causes. In the article, Saz makes the case that the crazy talk exhibited by some who have been diagnosed with a mental illness is not a valid reason for concluding that the person is insane, simply because one cannot comprehend the other. Another study building on Rosenhan's 1973 article examined how, in some real-life situations, people may indeed purposely fabricate symptoms of mental illness. The case study discussed in the article involved a man accused of sexually assaulting a teenage boy. When the perpetrator was evaluated for psychiatric problems, he displayed various psychotic behaviors. Upon the other examinations, clinicians found that he had faked all the symptoms. The authors point out that the mental health professionals traditionally have assumed the accuracy of patient statements in diagnosing psychological disorders. However, they suggest that inventing symptoms is a fundamental issue for all psychiatrists, especially complicated by external socio-legal issues, which could possibly serve as a motivation for the fabrication of psychopathology. In other words, we have to be careful that criminals aren't just faking their mental illness to get out of jail. How do the people themselves feel who have been given a psychiatrist diagnostic label? In a survey of more than 1,300 mental health consumers, Wall asked the participants about their experience of being discriminated against and stigmatized. The majority of respondents reportedly feeling the effects of the stigma surrounding mental illnesses from various sources, including community members in general, family, church members, co-workers, and even mental health professionals. In addition, the author reported the majority of respondents tended to try to conceal their disorders and worried a great deal that others would find out about their psychiatric status and treat them differently. They reported discouragement, hurt, anger, and low self-esteem as a result of their experience and urged public education as the means for reducing stigma. The authors of a related study entitled "Listen to My Madness" suggested that one possible approach that could help us understand the experience of those with mental illnesses is to interpret their impairment in society similar to our perception of those with defined disabilities. These authors propose that seriously mental ill individuals' interaction with society is often very similar to people with other disabilities in terms of receiving care. By applying a disability model to mentally ill, they will have an easier time gaining access and receiving the services and the help that they need.